I'm Dr. Anjali Singh. I'm a surgical oncologist. Today, I want to educate you about a common cancer, which is stomach or gastric cancer. So, to begin with, I'll give you a brief history about a very interesting story. So, in his last days, a French emperor, Napoleon Bonaparte, was having severe pain in his belly with nausea and vomiting, and few months later, he died. So, the autopsy showed a large cancer in the stomach. So, today we are going to discuss about the stomach cancer, which is also known as gastric cancer, and which is very common. And when people say stomach, they usually think it's the whole belly area, but in fact, it's the organ which comes just below your food pipe, and then where the food is stored and digested and then transferred to the intestine part. So, what causes stomach cancer? So, one of the most important factor is a bacteria which is known as H. pylori or Helicobacter pylori. This bacteria, funny looking bacteria, was actually discovered by two Australian scientists in 1980s. And how do you get infected with this bacteria? By consuming dirty water or less or improperly cooked food. The second most important cause is consumption of high salted food like pickles and fish. The consumption of high salted food is particularly seen in countries like China, Japan, or the southern part of the India. Third important cause is cigarette smoking and the alcohol. What are the warning signs? So in the initial stage, the symptoms are very silent. Careful if you're losing weight without any reason, or if there is fall in the hemoglobin without any obvious bleeding. If you feel nauseated all the time, or you feel full after eating small amount of food, or there is a vague pain in the upper part of your belly, then it should worry you for something serious. So when you have such symptoms, the first and the most important test that you undergo is the upper GI endoscopy, which is a medium to see the inside of your food pipe and the stomach. So if there is any mass or a tumor, they usually take the biopsy, and if that comes out to be a cancer, the next step is to stage the cancer to see where it has spread. So for that, we need CT scan or the PET scan. So if it is an early cancer, then we can go ahead with the surgery. If it is an advanced cancer, then usually we start with the chemotherapy and immunotherapy and then go ahead with the surgery. In surgery, depending upon the location of the tumor in your stomach, that involved part with margins are removed, and then it is anastomosed to the small intestine. If it spreads to multiple organs, that is if it is stage 4, then usually the chances of surgery is not there. In that case, we go ahead with the chemotherapy, immunotherapy, and sometimes targeted therapy. Now the question is, how do you prevent such things? So what are the protective factors? The first and the most important factor I would advocate is consumption of less salted food and eating fresh fruits and vegetables. Fruits especially which are rich in vitamin C like oranges, lemons, and berries, and staying fit both mentally and physically. Thank you so much for listening.